let's talk about another depression technique. Yeah, let's do that. Let me get rid of this awful thing. As you know, I am a real physician, and my license number is in the description below. But I hate everything that this thing represents. The elitism and the stress and the germs that it carries makes people uncomfortable with doctors. So how about we drown it? We're gonna hold it underwater and just drown it for a little bit. Much better. There we go. So here's the story. Today we're going to talk about a technique called a ring of light. What? I know, right? What have you been up to? Good little microphone brush. Give it a little quiet love and sound. I hope that sounds good. Tell me what's going on. Oh baby, don't I know it. Well, I'm actually in pain right now and a little bit exhausted and overwhelmed. I haven't been able to sleep, but I figured I'd keep a rough time with you. I'm not the only one suffering, right? Are you feeling like harming yourself or someone else today? Okay. If that ends up being the case, please use the crisis text line, which is below. Yeah. And there are other resources below too. Do you have a therapist? That information is below as well. Yeah. Oh yeah, it can be a lot more affordable that way. Instead of, crazy like $400 a visit, you can get in for 30 a visit and stuff like that, yeah. Please take care of you. So, the information I have for you is for your self-care only, right? I'm a generalist. I'm not a psychologist or a psychiatrist. I just have a lot of experience with mental health stuff as a patient myself. And as a physician, I was a prescribing physician for mental health patients. And I was a physician on deployment. Let's jump right in. So this exercise is something of dialectical behavioral therapy, and I'm familiar with the work we're working through the dialectical behavioral therapy work, which you're welcome to get down there also. No, that's not an affiliate, that's just a work that's helped me a lot. And I for the work and yourself as well. Yeah, exactly. Here's the deal. DBT, Dialectical Behavioral Therapy. In previous videos, we've even gone over studies for it and how it helps to prevent self-harm and other things like that, right? Well, one of the big techniques within it is called mindfulness, right? DBT can kind of be broken into mindfulness, distraction, and interpersonal techniques. And we went over a lot of the distraction techniques a couple months ago. So now we're on chapter 3 of the mindfulness techniques. And there is, you can look up some of the evidence for them. I think I rattled off a bunch of studies for you last time, but let's jump right in. I'd like you to get comfortable, sit quietly, close your eyes, and just listen and do this exercise, okay? It's going to take about 10 minutes you're going to need. Alright? So to begin, this is the third exercise that will help you focus more fully on the present moment. exercise progresses, the band of light will slowly move down your body. And as it does, you will become aware of the different physical sensations you're feeling beneath the band of light. As you continue to breathe with your eyes closed, continue to see the band of white light encircling the top of your head, and notice any physical sensations you feel on that part of your body. Perhaps you will notice your scalp tingling or itching. Whatever sensations you notice are okay. This mindfulness exercise is meant to help you be able to be in the moment and let your brain not deal with all the other pain that it's in. It's meant to give it a healing space so that your neurons have a rest, and so you can practice bringing your brain back away from all of the stress so that it doesn't overwhelm you with all these nasty thoughts it's been giving you. Those nasty thoughts can really hurt when you're depressed. So with this band of light, slowly it begins to descend around your head, passing over the tops of your ears, your eyes, and the top of your nose. As it does, become aware of any sensations you feel there, even small sensations. Notice the muscle tension you may feel as the band of light slowly descends over your mouth, nose, and chin. Continue to focus on any physical sensations you might be feeling there. Pay attention to the back of your head where you may be having a sensation. Notice any sensations you might be feeling in your mouth, on your tongue, or on your teeth. Continue to watch the band of light in your imagination descend around your neck, and notice any feelings in your throat, or any muscle tension on the back of your neck. Now the band widens and begins to move down your torso across the width of your shoulders. Notice any sensations, muscle tension, or tingling you might be feeling in your shoulders, upper back, upper arms, and upper chest area. As the band of light continues to descend down around your arms, notice any feelings you're aware of in your upper arms, elbows, forearms, wrists, hands, and fingers. Become aware of any tingling, itching, or tension you might be holding in those places. Now become aware of your chest, the middle of your back, the side of your torso, your lower back and stomach. Notice any tension or sensations, no matter how small they might be. As the band continues to move down your lower body, become aware of any sensations in your pelvic region, buttocks, and upper legs. Be sure to pay attention to the backs of your legs and notice any feelings there. Continue to watch the band of light descend around your lower legs, around your calves, shins, feet, and toes. Notice any feelings or tension you're experiencing. Then, as the band of light disappears, after This is a good one. This is a good one. It's helped me. I talk about these, why mindfulness is helpful, and on the Relaxation Club emails. Tea Time with Dragons is what I'm calling it now. And you can join me. You can join me for my Tea Time with Dragons. There's another place there. It doesn't cost anything. It's not the same as subscribing to the channel. It's in addition to subscribing to the channel, there is a special little email list where I send out little things that I've been figuring out, and I try to let you know ahead of time about things. You're kind of in the in club. You would get more information about YouTube videos when they come out, and if you miss some, you would get information about that. And herbs that I've been discovering, because I told you I've been working on this. I found that with the pain and the depression, things that I've been dealing with, it's been good to think about like what makes people feel better and feel happy. And so I started a tea company, and I love how this, I tested each thing for ASMR, I researched each thing. Before I put a new product on, I always look into it. And it's ethical. Anyway, I'm a little discouraged because it's not doing as I thought it would. I mean, it's a really good product, and I think that it could really help people to get those good antioxidants in their system. But anyway, whether you get it from me or not, there certainly are options to be exploring. What is the buzzing? There's a buzzing. Do you hear that buzzing? Oh man, it's driving me crazy. Oh, it's gone. I don't know. It was there for a second. Anyway, something I've been working on, and because there is evidence for green tea helping with cognition and mood and other things like that. And so this and other herbs I've been trying to get a little bit more of a handle on, because they don't talk about it as much in medical school, and they should, because there are a lot of new studies and things like that on these things. So anyway, sometimes you'll get news about those kind of things. Basically all the relaxation science. My goal is to become the relaxation doctor, basically. So, yeah. I hope this has been helpful. You matter, you know. It's hard to communicate that as much as I need to. I mean, you need to know it. You need to know that you matter. Not that you matter more than someone else. Not that your needs are more important than someone else's. And not that, like if you want to become a real superhero, you have to be willing to like lay down your needs for other people. You have to be willing to like get in there. But not because you don't think your needs are valuable. That's the thing. That's the difference between like Stockholm Syndrome and self-sacrifice. Stockholm Syndrome, you don't think you're valuable, you think only. But like, a hero knows the value of what they're laying down, and they lay it down anyway. Because it's not a valuable gift if you don't value your life. It doesn't really mean anything if you lay it down. Like if you think that, you are worthless, but if you lay it down and help other people and put yourself on the line, and make yourself valuable, like you do the best you can to take care of yourself so that you can be this good weapon to lay down, so that you can be valuable, you can get in there when you need to get in there. I mean, you're not even thinking about yourself anymore. It's not like with depression where you think about like, I suck, I suck, I suck. Or like arrogance and pride where it's like, I'm great, I'm great, I'm great. Like that narcissistic stuff. Healthy is just to not have to think about yourself at all. Just you take care of yourself as you need to take care of yourself. You do the things you need to do, but it's all natural. It's not all up in the ego. It's just, yeah, I gotta eat. Body says I gotta eat to take care of it. Brain is starting to feel a little down. I gotta take care of it so it doesn't have depression. I gotta cope with it and work with it. Like you just take care of yourself naturally so that you can then take care of other people. It doesn't become a big fuss. That's when I say you matter. It doesn't mean that other people don't matter. But I think the thing you don't understand understand is the unselfish thing. The irony is that there are people who will hear this and take it as a license to treat themselves better than anyone else. But there are other people who will hear this and argue with me and be like, no, I don't matter, I'm worthless. And it's like, y'all are all wrong. Yeah. You matter. And I want to see that person who matters fulfill their purpose and change the world like you. There's only one you and you're needed. So, take care of this tool. Fix up this tool so it can go out and do its thing. Anyway, I hope this exercise is helpful. It helps you to